Well, if you are old enough to remember, or if you watch Antenna TV on WBOC Classics, you may have seen the old episodes of Sanford and Son where Fred Sanford would get upset about something and grab his chest and say, "I'm coming, Elizabeth." You remember that? It always got a laugh when Fred faked a heart attack, but we all know a heart attack is no laughing matter. In fact, experiencing symptoms suggestive of a heart attack should prompt a call to 911. Well, Dr. Jeffrey Wieland is the chief of the Division of Cardiology at Peninsula Regional Medical Center and joins us this afternoon as part of Heart Month. So we've seen those classic TV stereotypes where they're clutching the chest, but there are other symptoms that we should look for.
Absolutely. The elephant on the chest is the one that everybody knows, but there are a lot of other classic symptoms to be aware of. For example, shortness of breath, palpitations, numbness and tingling in the left arm, sweatiness sort of out of the blue. So those are symptoms to consider. If those come on, you should think, well, gee, this is a little bit out of the ordinary. You know, maybe this is what they're talking about.
And the symptoms sometimes differ between men and women?
Absolutely. I think it took a long time for the medical community to recognize the difference. I think partly because people always associated heart attacks with men, but as women started smoking more and getting other risk factor illnesses like high blood pressure and diabetes, we came to recognize that heart attacks are frequent in women, just as frequent as in men, and their symptoms are different. They can be things like jaw pain, neck pain, flushing, again, shortness of breath, and tingling types of sensations. So if those are symptoms that you experience as a woman and they're unexpected and seem out of the norm for you, you should seriously think about getting them checked out.
Right, and at some point you should call 911, is that correct?
Absolutely. So when you get symptoms out of the ordinary like this and they are persistent, so not fleeting symptoms of a few seconds, but something more on the order of minutes, and you're not feeling quite right, you should seek medical attention. And it's better safe than sorry, because if you're having a heart attack, the sooner you get into the medical system to get this taken care of, the more likely is that you'll survive.
Yeah, and surviving, of course, is the most important part, but there's also other factors. If you wait too long, there's damage that can be done.
That's right. So the heart attacks are typically caused by blood clots forming on top of high-grade plaques in the coronary arteries, and once that clot has formed, the blood is cut off from the muscle downstream, and as time ticks by, that muscle starts to die. So you basically, the sooner you get in, the better. And if it's more than 24 hours, usually most of the damage has been done. So that's why we say time is muscle. We have a team that is ready to open those arteries up as soon as we're aware that you're having that problem.
And that's where I guess the term door to balloon time comes in.
That's right. It's not when you're going to the circus. This is a more serious matter. And basically the guidelines have evolved that we want to get that artery open within 90 minutes of getting to the hospital. And it's clear that people who, when you have a heart attack, 1 out of 10 people will not survive. And to improve your likelihood of survival, the quicker you get into the system and the quicker you get treatment, the better. And in this day and age, it used to be balloons, and now virtually all people are getting stented because stents seem to have more durability.
And you brought an example of one, and it's very, very small, but a very important I guess, medical device?
Absolutely. Its discovery and implementation were critical in improving survival with heart attacks. And they now come in all sizes and lengths, and we're ready for all shapes of arteries.
Just looks like a little spring out of a
It does, out of
yeah.
a ballpoint pen.
Okay, so PRMC is a designated cardiac interventional center. What does that mean?
So we're one of very few hospitals in the state of Maryland that have been given this distinction. We're very proud of it and take it seriously. This means that if you call 911 and the symptoms are suggestive of a heart attack, that the ambulance that picks you up is going to take you to the nearest center of excellence. And here in Salisbury, we end up serving a large radius of communities to provide this type of therapy. And as I said, it's certified by the state, and it's something we take great pride in.
Yeah, and we are fortunate to have it.
No,
Dr. Jeffrey Wieland, thank you so much for coming in and talking about this very important topic.
Thank you, Lisa.